All right, welcome everyone. Welcome to our Mayo Clinic Ophthalmology Residency virtual open house. I am Andrew Barkmeyer. I'm the residency program director and I'm a vitreoretinal surgeon here in Mayo Clinic in Rochester, Minnesota. We are very excited to share some information on our program, some background information, and to introduce you to some of our colleagues, our faculty and residents who make us who we are. You can take a look, there's a chat section. Please feel free to enter some questions. In sort of a running fashion, panel will answer some of those questions. And then at the very end of our presentation here, we will have a panel where we'll discuss a Q&A. The panel members, you can also share some contact information in the chat if you'd like. So Mayo Clinic, the institution, really shapes the Department of Ophthalmology here in our residency training program. Mayo was formed in the late 1800s by the Mayo brothers, Charlie and Will Mayo, and their father, and they created an integrated multi-specialty health system with a multi-specialty integrated health record system that was really unique at the time. It was an era where providers were very individual and there was not much collaboration. And that's kind of what helped Mayo grow from a small regional practice into the international medical center that it is. And it's really that unique center of collaboration and the interactions between specialties that do that. And I just wanted to take a moment to do a brief shout out for anyone who has not seen the Mayo Clinic documentary by Ken Burns. It is truly fantastic, and I recommend it, even if you don't have a connection to Mayo or end up not matching here, or you are, as an ophthalmologist, it's a fantastic watch. But Mayo Clinic started in Rochester, Minnesota, and then the Mayo Clinic Arizona and Florida sites went online in the 1980s. And then soon after, in 1990, the Mayo Clinic Health System was formed. If you take a look at this map here, you see Rochester, which is the white star. All these sites surrounding it are Mayo Clinic health clinics and hospitals. And if you look to the east, south, west, and northeast, these hospitals, these whole regions are primarily owned and operated by Mayo Clinic. And there are a lot of benefits of that. So this is an extremely stable healthcare system. We have stable referral patterns, and it's very resilient to whims of insurers or changes of the times. And it's also really unique in the sense that we have a consistent mix of the bread and butter ophthalmology patients and cases and surgeries and procedures, but that's also mixed with the complex referrals and tertiary and quaternary referrals that come from elsewhere in the state and the region, country, and internationally. And it also affords us the opportunity for our trainees to work with these community-based comprehensive ophthalmologists, and you can go out into the community. They come in and help with surgeries. Mayo Clinic in Rochester here is the largest GME program in the country. It's an extremely diverse and collaborative community, and we're really excited that our interns now have the opportunity to be in our integrated PGY1 internship and work very, very closely with the rest of the institution. So our Department of Ophthalmology and institution have a really unique culture and values. And one of the interesting and unique aspects of it is the 100% salaried model. So if you look at all of the faculty, 100% salaried with no volume-based incentives really allows everyone to focus on the needs of the patients. And the three shields in the Mayo logo represent the patient care, education, and research. Within this environment, this allows, we have really fantastic clinical and surgical care. And the progression, we're going to talk a bit about the clinical and surgical progression, the curriculum, the breadth and surgical numbers in a little bit. But the other thing we're going to talk about is the resident urgent care clinics and the continuity clinics. These are really the jewel of our training program. And in these clinics, this is very unique. You see a very unique mix of the basic bread and butter patients and complex multi-specialty care issues where these patients come in and they say, you, the PGY2 resident, and you see them early on. And the most important thing here is it's not a triage process where the resident sees the patient and then says, you need to go see retina. You actually take care of these patients and you're fully supported from the very beginning of your PGY2 year to take care of these patients. All of the resources and expertise of the department allow you to follow these patients over time, longitudinal care. You get to build relationships with these patients from your PGY 2 to 4 years and provide all of the clinical and procedural and surgical care that they need. And sort of part and parcel with this is our fundamental belief in the importance of the graduated autonomy and hands-on practice. We always keep you on the edge of your seat. You're basically always practice at the edge of your comfort level. It's a very high responsibility practice, but as opposed to more of an observation medical student role, it really helps you gain the skills you need. And we're going to talk a little bit more about the resources here. There's fantastic resources, and we're just looking to recruit an extremely talented and diverse and collaborative group of trainees so we can mentor and support you and open doors. We do not have any preconceived notions of what someone should be, how they should fit, where they can go after our program. Our job is to really give you every option on the menu to grow and thrive. And at this point, we're going to start the second portion of our program. I'm going to turn over to Dr. Sophie Bakri, who is the chair of our ophthalmology department.
Well, thank you, Dr. Barkmeyer. So welcome, everyone. It's a real pleasure to have everybody here and be able to share what we'd like to let you know about the Mayo Clinic Department of Ophthalmology. I've been here since 2005 on faculty, and I've always been impressed with the leadership of the residency program and our educational programs, and the amount of resources and respect we give to the residents and trainees here. Dr. Barkmeyer and Dr. Tooley are really outstanding resident advocates who are always looking to make the program better and incorporate resident feedback to try to improve the experience. So really want to thank them from the bottom of my heart for everything that they have done so far. So why Mayo Clinic, and what makes us different? What makes us unique? As you can see here, there is a large faculty, and this is just the faculty and residents in Rochester. There are also some faculty in the health system, which you will interact with as well. And the faculty really cover all areas of ophthalmology. But beyond that, and beyond being a top eye center, we are also part of a much larger institution where everything is integrated. And I think that's really important because at the end of the day, yes, we're managing an eyeball, but we're managing a complete patient who has needs with systemic disease as well. And so you'll learn how to manage patient care very effectively within a larger institution. As part of belonging to a larger institution and being integrated, we have access to really unparalleled resources, not only clinical resources, but also research opportunities, also further education opportunities. And there are many things which you can continue to learn beyond ophthalmology while you're a resident here, and participate in bigger things such as leadership training and really advocacy for the profession. So as Dr. Barkmeyer very nicely said, there isn't really a stereotype here who comes. Really, the only stereotype we have is that everybody puts the needs of the patient first, and that everybody really cares about their education and training. And beyond that, we will help take care and provide you with every opportunity to learn the practice of ophthalmology and be successful, whether you go on to fellowship training or whether you go on to comprehensive ophthalmology, whether you practice in the community or whether you practice in academics or in another setting. So I really think if you come here, the world is your oyster, plenty of opportunities. But I think most importantly, the opportunities lie within a tremendously supportive faculty who are, very kind and dedicated. And you'll have the opportunity to do a lot of surgical cases and see both primary eye care cases, but complex cases from across the globe, and learn from, the very best faculty. And I think that's all done in a very nice, respectful and supportive environment. So again, thank you all for attending, and we look forward to your questions.
Thank you so much, Dr. Bakri. I'm Andrea Tooley. I'm the Associate Residency Program Director. It's an absolute honor to speak with you all today about Mayo Clinic. And something I love talking about is our early surgical and procedural training, because this is something I'm passionate about. And it's something as a residency program that we believe wholeheartedly and feel very strongly about. And that's getting our residents involved in surgery right off the bat. We're a very heavy surgical program. We have elite surgical training, and there's a lot of different ways that we do that. So we'll talk a little bit about our surgical practice curriculum. That involves 2 different wet labs. We have kind of our traditional wet lab that we've used with our phaco machine, but we also have a brand new 5 microscope wet lab. You can see in this photo down here, it's absolutely beautiful, state of the art. And that's allowing us to do more kind of group activities. You also get one-on-one practice with corneal suturing, glaucoma wet labs, phaco wet labs. These are all starting you off really early. We do an oculoplastics wet lab every year. We just had that kind of a suturing course. And then we have an Olympics, which is a competition that I'm very passionate about that I'm going to talk about here in just a second. Go back one slide, Dr. Barkmeyer. In your PGY1 year, so starting immediately off the bat, you're going to get surgical experience with oculoplastics. You spend a month on plastics, and that's a great place to start because it's not microsurgery. You're really learning tissue handling. You're learning how to suture first. Then you go over and spend a month in cornea and cataract as a PGY1. So immediately you're getting that training. And then through PGY2, you have more cornea cataract, peds strabismus, more oculoplastics, and retina oncology. But you're also doing all the procedures in our emergency resident run clinic, and you're going to hear a lot about that. So we're getting you started immediately right off the bat, and then let's go to Olympics. So Olympics is an activity that we do right before our new PGY2 start taking primary call. And the goal of this is to get you comfortable with the emergency skills that you'll be performing on call. So that's lateral canthotomy cantholysis, an AC paracentesis, vitreous tap and inject, retrobulbar injection, eyelid laceration repair, and a tarsorrhaphy. So these are all kind of the key things that you're performing on call. We do them as a group, and then you get to compete. It's really fun. And all of that sets you up for being prepared to then do it on patients on call. So really, this is a huge passion of ours, is getting you involved right away and very early. And I think that speaks to our surgical training. We're going to talk way more about this, and please leave all your questions in the chat. I'll turn it over for now, but I'd love to come back and talk more about this really soon.
Well, thanks, Dr. Tooley. And I'd just like to thank everybody for taking the time out of their busy evenings to join us to learn more about our program here. My name is Amir Khan. I'm on the Cataract Comprehensive Service. I came to Mayo as a medical student and said 4 years and I'm done, but that didn't work out according to plan. Stayed for residency and staff. So Mayo Clinic, as others have said, and others will probably say after me, is a great place to work and learn. And I think, my tenure here is not unique. I think there's a lot of stability in the program and a lot of loyalty to the institution. So you're going to hear from me describing some of our ophthalmology curriculum, and then one of our recent graduates who's now on staff, Dr. Bryce All, will also help. So as we alluded to, Dr. Tooley showed you our new procedural skills lab that has the 5 microscopes. But in addition to that, we also have an IC, and you can see one of our former graduates, Dr. Victoria Lawson here, working on basically it's a computer simulator. And each aspect of simulation has some strengths and weaknesses. And really one of the strengths of the IC is the capsulorhexis. Prior to having the IC, I think one of the most harrowing parts of the cataract procedure for both the staff and the residents was the capsulorhexis. And now, if the residents can master the capsulorhexis on the icy, they're pretty confident in being able to do it in the real situation. In addition to that, we also have another surgical wet lab with human cadaver eyes, occasionally pig eyes, and that's with using a Centurion phaco machine and an OR microscope. And we have one-on-one sessions that I do with the residents, going over the steps of cataract surgery, the instrumentation for cataract surgery, settings for the machines for cataract surgery, and then actually the techniques of performing the cataract surgery. In addition to the human cadaver eyes, we also have access to synthetic eyes, which is what the BioNico model eyes are. So the wet labs happen right around the PGY3 time, a little more proximal to when you're doing some of your cataract surgery training. In PGY3, you can see that's really the bulk of your surgical preparations and laying the groundwork for what you're going to be doing as a chief. I'm just going to speak mainly to the cataract numbers because that's what I know the best. I use numbers like 10 to 20. Dr. Barkmeyer likes to use 15 to 25, but that's our goal, to get you for complete cases when you're a PGY3 resident. And really getting you those cases, I think, makes you more confident and you gain skills. So when you get to be a PGY4 resident, you can really hit the ground running. And I'm going to turn this over to Dr. Bryce All to describe the PGY4 year.
Thank you, Dr. Khan. Yep, I can jump in here and give a little bit more perspective on that, given that I just graduated from my PGY4 year this past summer, and I'm now on staff again with the comprehensive and cataract surgery folks. So you can see our gross numbers there. I think that's something that's a factor to consider, and ours are very good with that, mean of 231 last year in terms of cataract surgeries. But I also want to highlight that I think it's nice that our program does a really good job in terms of getting you the experience in a couple of different ways. First, in terms of the cataract surgery part of this is an essential skill to learn, even if you don't end up going into a area in which you do cataract surgery. Most of us will. And so such a crucial skill means that you really want to first learn that skill, but then really develop and learn your own techniques. And so part of that is learning from the different surgeons here who have different techniques in terms of learning divide and conquer, horizontal chop, vertical chop, that kind of a thing. But also I'll highlight the VA rotation on the bottom here as well. For that, we do 3 months up at the Minneapolis VA. And that's a really nice experience, both in terms of surgically and clinically. Clinically, it's nice to see how another system runs and kind of work in a different system, because sometimes we get a little bit spoiled here at Mayo with how good a lot of things are for us. And it's interesting to see different ways in which we maybe can be more appreciative of what we have in ways. But also because you get to work then with a bunch of different surgeons there as well in terms of working on your cataract surgery techniques. And so I picked up things that I do from one surgeon here, one surgeon there, and my kind of default technique is really a combination of a lot of the different surgeons I worked with in training, both here at Mayo, but also up at the VA. And so I think that's a really great experience as well in terms of both getting some extra numbers for cataract surgery, but also really getting to see different techniques, different tips and tricks from other perspectives. But the other thing I'll highlight, and we might go over a little bit of this later too, is that there's some flexibility within your PGY4 year. Basically, we're mostly running our own clinics all year long. And if you know that you're interested in something in particular, whether that's you're going into plastics or glaucoma, or you know you want to do comprehensive, but really be able to kind of cover anything for your more rural environment, you can tailor some of your training to that ends. So for instance, for me, I wanted to make sure that I'd have a full skill set working as a comprehensive ophthalmologist. So I did some extra MIG stuff, but also there's options for if you're going into glaucoma to do some extra glaucoma surgery days, work with the glaucoma team or cornea or whatever specialty you're in. And so with those extra flex days or I forget what we even call them, to be honest. But anyway, with those days in PGY4 a year, you can tailor your experience to what you are planning on going into in the future. So I think both clinically and surgically, that's really helpful to be able to get even a little bit more experience within that PGY4 year towards your future goals. Elective days. Yeah, Dr. Khan. There you go. We can go to the next slide, Dr. Barkmeyer.
So, thanks, Bryce. I just want to touch on a little bit more of the surgical training. The cataract training is, I think, exceptional. Even I was a resident at Mayo, and then I left for my fellowship and I came back. Even though I don't do cataracts, I totally agree it's exceptional training. But I think something that's really strong about our program is the kind of breadth of all the different trainings. Like you mentioned, you wanted to do more MIGs. There's lots of people who want to do comp, but they want to go somewhere rural and they want to be able to do more plastics. And so they come and spend more time on the plastic service. You get your numbers so early. And then the other thing is, because you're so autonomous in our resident clinic, there's so many procedural things that our residents are absolutely exceptional. We'll talk more about lasers and even little eyelid biopsies, but tap and injects, basically everything you guys are doing from a PGY1 level, honestly, but especially as a PGY2. We're going to talk more about the resident clinic, but in the resident run clinic, you have so much autonomy that you're doing. If anyone needs a procedure, you're the one doing it as the PGY2 resident. If they need any kind of laser, if they need a little lid lesion biopsy, if they need a chalazion removed, anything like that, it's such a procedural heavy residency, because we give you all that autonomy. And I think all of that kind of builds your surgical skill armamentarium just in general. So it's not just in the operating room, but it's also in clinic. So with that, let's kind of foray into our resident run clinic, because I think this is the crown jewel of Mayo Ophthalmology. And I know all of our residents will agree, this is the place where you will grow the most. You become an ophthalmologist in our resident run clinics, because the autonomy is absolutely incredible. And we push you, just like Dr. Barkmeyer said, we keep you on the edge of your seat. It's stressful, but it's incredible. So I'm going to turn it over to our residents to talk about it.
Thank you, Dr. Tooley. So I'm Blake Fortes. I'm one of the PGY4 residents here at Mayo. And so I'll discuss our resident run clinics here. So also known as COS, or the Comprehensive Ophthalmology Service. And so basically this is our acute, urgent, emergent eye care clinic, where we see patients who call in with urgent eye concerns, patients from the emergency department who are able to transfer over to clinic, and patients who are, inpatient consults from the adjoining hospital at Methodist Hospital. And so basically here we see, just as Dr. Barkmeyer mentioned, we see really an incredibly diverse array of patients, ranging from kind of bread and butter cases all the way to really incredibly complex patients with, ocular manifestations of systemic disease who require multidisciplinary input, including kind of multi-subspecialty ophthalmic input. And so we see patients here really from surrounding communities, surrounding states here from Minnesota, Iowa, Wisconsin, North and South Dakota, and patients really from all across the country and all kind of throughout the world who come to receive their care here at Mayo. And really kind of a central aspect of the program and of our resident run clinics and COS clinic is kind of the graduated autonomy that we have as residents. And so, when we first start out for the first couple of months of PGY2 year, really for those first 2 months, the PGY2 residents see every patient and staff every patient directly with one of the PGY4 residents, and kind of, start getting their feet wet and kind of learning the process and learning ophthalmology initially. And then for the next 6 months after those initial 2 months, then our PGY2 residents staff every patient, see every patient directly with one of the consultants, kind of ranging in different subspecialty areas throughout those 6 months, and learn different practice patterns, kind of learn additional exam findings and other kind of treatment and management pathways that they then kind of refine as time goes on. And so after those first 8 months pass, then basically our PGY2 residents then graduate on to basically seeing patients completely independently at that point. However, obviously, if there's ever any question or anything kind of in doubt or anything they're not completely comfortable or confident in, then we really encourage our PGY2s and PGY3s to then seek out PGY4s, seek out our fellows in different subspecialty areas, as well as our consultants, as we call them here at Mayo, or our attending physicians in different subspecialty areas, to then discuss kind of further points on our patients. And really, all it takes in either our COS clinics or in our longitudinal, resident continuity clinics is just kind of stepping out of clinic, going down the hall and chatting for a few minutes with an expert in an area and kind of getting expert recommendations on the management of your patient, which I think is critical. Some other things here, we have really all the equipment, lenses, and tools you'd ever need in ophthalmology. We have a well-stocked minor procedure room with an operating room microscope. We have lasers, slit lamp lasers, and YAG, SLT, kind of everything you'd ever need in ophthalmology. We also have technicians who start up all our patients on our resident-run clinics and on COS clinics, which is really kind of a unique feature of our program, and that doesn't exist in every program. That actually allows us to increase our patient volume that we can see in our resident-run clinics, which kind of therefore increases our learning opportunities that we have in our clinics as well. And so really overall, COS is really a strength and a cornerstone of our program here. So I'll just hand it off over to Dr. Ali Salman. He's one of our other PGY4s, and he'll just discuss some additional points about our resident-run clinics.
Hi, everyone. Is my picture showing there?
Yeah.
Okay, great. Well, thanks everyone for joining. It's a pleasure to meet you guys virtually. And I just want to echo everything that's been said by the faculty and also Dr. Fortes as well, especially about COS Clinic. We really can't overstate how impactful COS Clinic has been to our education as an ophthalmologist. It's not only about the breadth of pathology. I mean, you're going to see the bread and butter. You're going to see that level slightly above the bread and butter. That is like the local referrals. Dr. Barkmeyer talked about the Mayo Clinic health systems that are local. So we get a lot of referrals from them for complex ulcers and endophthalmitis and that type of thing that you see from a PGY 2 level onwards. But then you also get the things that you see in the subspecialty clinics that are referred internationally or nationally that you really wouldn't be able to be exposed to at most other places. And so, as a PGY2, I remember, just to give you guys, a little bit of context, in my very first week of COS, I lasered a retinal tear. And of course, it needed a few more spots to be put in by my chief. But the opportunity is there, and everyone is encouraging you to do hands-on things. And really, there's no, it's not like if you're confident and comfortable and you've demonstrated competence in the exam, there's really nothing else holding you back from doing, these procedures and pushing your limits of what you've learned and what you can do. And I think it's a fantastic experience. The autonomy cannot be overstated. Really, I mean, you're seeing a patient in, 7-8 months into your PGY2 year, you're seeing a patient in clinic, you've determined, they need a YAG capsulotomy or maybe they need a retinal tear. And you do have to get, staff approval, of course. But, as long as they approve, you go ahead and do the laser or do the procedure. And you send the patient on their way and you see them back appropriately. And you're doing that as a PGY2. And the same thing goes on call as well. So I really, I think that the things like the Olympics that Dr. Tooley was talking about, and also our experience on COS really sets you up with a strong foundation in ophthalmology moving forward so that you're ready to deal with really almost anything that comes through on call and moving forward in COS. I mean, patients genuinely talk to you as their one eye doctor, even as a PGY2. I have patients that I've seen since my first week or first month of PGY2, and I've still followed them for whatever conditions they have. And if they have any issues, if they develop cataracts or if they develop anything else, develop a retinal tear, I'm their provider. And so I'm the one they reach out to, and I can provide those procedures for them as needed. So I'll pass things off here to Dr. Shah.
All right, are you guys able to hear me? Perfect.
Yes.
So my name is Sami. I'm one of the PGY4 residents as well, with Ali and Blake. And I was going to talk a little bit more about the volunteering and life in Rochester. So we have some wonderful opportunities to volunteer in the community of Rochester as well, and kind of serve the underprivileged population that lives in the surrounding area. So I went to medical school here at Mayo as well, and the Salvation Army Eye Clinic was truly a really unique experience from the standpoint of a medical student, but as well as a resident, because it's a eye clinic that functions once a month. And during that evening time, we see a lot of patients that are uninsured, that come from lower socioeconomic backgrounds. Essentially, anyone who wants an eye exam for whatever reason could come there. And as a medical student, it was a great opportunity for me to get involved in to just learn the basics of an ophthalmic eye exam. And as a resident, it's a wonderful opportunity to kind of work with some of our attendings who volunteered at the clinic as well, and really work up a patient with whatever complaint that they're coming in with. And so that could be something as simple as just a diabetic eye exam to make sure that they don't have any diabetic retinopathy, versus someone who's had blurry vision for the last month and now has a choroidal melanoma that you're seeing in the exam room. And then you can get them plugged into the Mayo Clinic to get that care, to allow them to be able to move forward with it. Student Sight Savers is another program that we often work with the medical students, where we go ahead and do different ophthalmic eye screenings or glaucoma screenings within the surrounding communities. And overall, we just have a really great relationship with the medical school here to be able to work on research projects together, be a mentor. So, when I was a medical student, I had current Mayo residents who were mentors for me, who kind of helped me along and showed me the path to residency. And then in my time as a resident, I've done something similar as well. So these photos show some of those events. And then I think if you go to the next slide, we were going to talk about how fun we are as a resident group as well. Actually, sorry, that's after this. So to talk about Rochester itself, I am someone who came from Southern California. So when I first moved to Minnesota, I know that I had a very big concern regarding being able to settle here or transition from a very different setting, but it actually is a really amazing city in terms of the perfect size to go to training. And so the city itself has a population of about 120,000 people. It is very convenient, it's very safe, it's very affordable. And so you have the benefit of being able to access pretty much anything that you need for your day-to-day life within a 10 to 15-minute drive. And that's something that's very helpful. When you're on call, you don't have to drive in the middle of the night for a half an hour to be able to go see a patient in the ED. You're not covering 5 different hospitals across the city in order to be able to, see patients at every single hospital. You just really have one ER and 2 hospitals all within one campus. You have the ability to have access to the Twin Cities relatively close. So it's an hour and 15-minute drive. It's a straight shot. There really is never any traffic. And so it's a wonderful way to kind of get your big city fix while living in a very, very easy to live city as a resident, if you have a family or if you don't have a family. So I've really grown to love the area a lot. The photos here kind of show a couple of the trails and things like that. So I think the green photo shows our Douglas Trail. And so we actually have a trail that connects Rochester to one of the surrounding cities. And it's a 14-mile bike ride. And so I've done that on weekends before, where you bike 14 miles one way and then you have ice cream or something and then you bike back, and it's a wonderful activity. We have a lot of trails and state parks around to go on hikes during the winter or during the summer, fall, spring. And then these photos show some of our activities as a group. So we have photos where we've thrown baby showers for our co-residents. We've gone hiking as a group. There's a ski resort just nearby where you can go for a day ski pass if you'd like. Our residents tend to go on group hikes together. We usually do one resident retreat at the beginning of the year. And so last year we had done something where we went to a local state park and hung out and had food and things together, and then got tacos with our PD and APD. This year we switched it up a little bit and went to a pizza farm. So for those who are not aware of what a pizza farm is, it's this really cool Midwest concept where they have essentially, pizzas that are made on a actual farm with using very local ingredients from the farm itself. And it's truly a wonderful experience. We played games over there. We went on a hike before the pizza farm. So, a lot of opportunities, and we truly are a family for each other. And so that we can kind of take care of each other, hang out outside of work, hang out at work. And I think Dr. Tooley mentioned that she's very right. While we are doing the retreat, our APD and PD cover the COS clinic for us. So it's a really special day where, we get to go escape and bond as a group, and not have the stress of having to cover clinic and cover patients. So that's really awesome. Happy to answer any of the questions people have about moving to Rochester or living in Rochester or anything like that as well.
Hello,
I'll
everyone.
hand it over to Dr. Chen here.
Great. I'm John Chen. I'm one of the neuro-ophthalmologists, and I agree with Sammy. Rochester is a wonderful place to live, and I think you'll like it a lot. I just want to talk about our mentorship here at Mayo Clinic. I really think that's one of our big strengths, both formal and informal components of mentorship. We have multiple faculty in pretty much every single subspecialty, so no matter what you want to go into, you'll have mentors that can kind of guide you through that process and get you to the fellowship you want. If you want to do comprehensive ophthalmology, we have phenomenal, again, specialists in all fields, cataracts, and everything you might want to do. I talked about going into rural areas. If you want to do more lids, you can kind of get that more of that surgery during your chief year and all throughout the residency. And so, again, I think mentorship is wonderful here. We have, some phenomenal leaders that you can hear about career advice and professionalism. We have Dr. George Bartley, who's actually the CEO of the American Board of Ophthalmology. Of course, we have Dr. Sophie Bakri as our chair, who's a phenomenal role model. And again, I think all the faculty here just have a passion for teaching. That's why one of the main reasons we're in an academic center is because we get a chance to teach our residents, our medical students. And so I think you'll find the mentorship here at Mayo Clinic wonderful. We talked about, I know you heard a lot about the surgical opportunities, but again, we have phenomenal surgeons that love to teach, like Dr. Amir Khan and others. Another big thing is research, and we have wonderful research opportunities. During the PGY 3-year, the expectation is to do a research thesis project, and that's where you have pretty much you kind of dedicate a year and a half or 2 years toward a research project that you present during your PGY 3-year, where you actually have assigned a mentor and essentially get a chance to do a wonderful project. Of course, a lot of people do a lot of other projects, and it's not uncommon for residents to publish 10 publications. We have a ton of resources for research, including the Rochester Epidemiology Project, where you can actually look at the incidences of various diseases, the severity of diseases, amazing statistic support, and really extensive resources. And again, we're here to really try to mentor you in research, in clinic, in surgery, and in career as well. And so again, I think it's a wonderful resource. Again, our faculty is really dedicated to the next generation of ophthalmologists. So I turn over to Dr. Tooley. Again, wonderful research opportunities, and then you get a chance to present the research. It's a pretty phenomenal opportunity, which Dr. Tooley is going to talk about.
Thanks, Dr. Chen. Yeah, you're exactly right. So we're really dedicated to resident research. And the other thing we're dedicated to is it's not just the research, it's not just getting the publications, but it's getting you on the podium. It's getting you to national meetings, getting you to meet those people, have those networking opportunities, have the learning opportunities about going to national conferences, and presenting your research. So it's not just doing the work, but it's also being on the podium. We feel really strongly about getting our residents to those conferences. And I think we have probably one of the most generous conference policies that I've ever heard of. Basically, you get to present your research as much as you want. If you've got presentations, I'll kind of go through, flip through some of these photos, Dr. Barkmeyer, and then I can get to the nitty gritty. But we go to Women in Ophthalmology every year. That's a huge priority for us. This is ARVO, Academy, keep going. More ARVO, more Academy, Hawaiian Eye. Like any conference you want to go to is unlimited, but here's basically the nitty gritty so you guys can see this and screenshot it or whatever if you want. So you get up to 5 research presentation trips per year, which is a ton. And so if you have a poster, if you have a talk, anything you want, you basically get to go. Then you get one attendance trip up to 5 days for your residency. A lot of our residents do the Cataract Telling It Like It Is. But if you wanted to go to a boards review class, if you wanted to go to some, like if I wanted to go to an oculoplastics meeting or anything, the sky's the limit. It's an attendance trip. You can do whatever you want. You get one additional trip to Academy that's not counted as a presentation trip or an attendance trip. We really want to prioritize our residents making it to Academy. Our Minnesota Academy of Ophthalmology is also an extremely robust state society. I didn't know anything about state societies when I was applying to residency, but it's huge for your future career networking opportunities, really important for advocacy in ophthalmology. And some states don't have strong state societies. The Minnesota Society is incredible. We win the Best State Society Award all the time. And we have monthly meetings where we bring in guest speakers. You always get to go to those. There's a shuttle. There's a bus that will take you from Rochester to Minneapolis to go to these in person. They've been virtual, but now we're switching back to in person. We sponsor residents to go to Mid-Year Forum, which is an advocacy event for Academy. These are all huge opportunities for you to develop as a leader, for you to develop as a researcher, and for also you to figure out where you want your career to go. I became really involved in Academy leadership as a resident because I got to go on all these trips. And so I don't think you can find a more generous trip and travel policy. We can talk about it more. I could go on forever, but I'll stop there for now and turn it back to Dr. Barkmeyer.
Yeah, so we are really, really excited. We just got the heads up again about a month ago that we are going back live again with our international ophthalmology rotation. So we have a fully funded 2-week opportunity to go abroad to developing world countries. And there's a program called the Mayo International Health Program that vets programs and the safety and the opportunities and the learning experiences at these programs, and then provides a stipend and research, stipend and the insurance and everything that you need to go on these programs, and the department funds the rest. We've had people recently go to Gabon and Ghana and a couple different sites in India, and Dr. Shah is actually going to Tanzania in January. We're really excited about this. You know, it's been offline for a couple years with COVID, but this is a really important part to kind of expand your horizons with international ophthalmology and so develop some skill sets as well. So we're really excited about our integrated ophthalmology internship. The Mayo Clinic is such a unique place in culture, and the opportunity to come in, get enculturated in all these just like elite specialties across medicine, where we have literally world-class educators and faculty in every area, and you can go interact with the residents, the fellows in all these different areas, and really expand your network of friends and just expand opportunities for colleagues and networking. And it's really a great experience. We've designed the curriculum to really integrate the cornea, oculoplastic, and comprehensive ophthalmology urgent care service into the first year. But we also identify a variety of other rotations that are really what we feel is just like ideal for creating, fantastic ophthalmologists that really meshes well. And then there's some really neat electives. I was just talking to Grayson, one of our PGY ones today. There's a rotation on clinical ethics. There's preventative medicine. There's so many interesting things. I'll turn this over for Dr. Cracker to talk a little bit about her experience in the internship.
Hi, everybody. I'm Jess. Hopefully everyone can hear me. I'm currently a PGY2, former PGY1 at Mayo Clinic Ophthalmology. And it was honestly, going through all my interviews, it was the best intern year. And I don't think that you should pick your residency program based on the intern year. You should pick it overall. But the exposure that we have to ophthalmology is pretty unparalleled. Cornea, oculoplastics, and comprehensive ophthalmology clinic are really what you'll need when you're starting out for call the next year. And I personally hadn't had any exposure to cornea beforehand, so the learning was just astronomical. And the attendings are really, really phenomenal in those rotations as well. You also get a little sprinkle of neuro-ophthalmology, so we have a lot of representation in this chat with those attendings as well. And I think in each of those rotations, I had some form of publication, presentation, case report, lecture. So they throw you in a good way. And if you're comfortable, they'll keep adding more to your plate. But if you say, you know, I struggle with this exam, I'm going to take some time and make sure I'm getting what I need to out of this rotation, they're supportive of that as well. And the other rotations, you know, I can't speak for my colleagues, like Dr. Kopinski really, really liked cardiology, but after 2 weeks, I'd had enough of NSTEMIs. So, you know, I think it's important to learn how to manage those things for medicine and for your patients as well. For example, I sent someone to the emergency department today, and I hate to say it, but I learned that on my cardiology rotation. So it is important just for being a physician as well as just an ophthalmologist. But I can't speak enough to our awesome intern year. And as Dr. Tooley mentioned, our very generous travel policies allow you to take advantage of the resources we have for research and advocacy and all these other things. I'm happy to answer any other questions you have specifically about the internship, but I don't want to monopolize time because I know we're limited.
I'm gonna kind of turn it on for some questions, if that's okay. I know we had trouble in the chat and a lot of questions went direct to me. And then some of our residents and Dr. All have been answering some questions in the chat. Hold on, let me read what Bryce just said. Yes, very close working bond between classes is at PGY2. Spend the first 2 months directly staffing every patient with PGY4s. So it's a great mentorship opportunity. Exactly. So there was a question that came in earlier that I really, really liked, asking about how engaged are the residents in mentorship, teaching, and curriculum development. And I think that we have a very kind of peer-to-peer teaching model, partially because you do get a lot of autonomy and your senior residents are guiding you along the way. Kind of like we talked about, like Blake and Ali talked about during COS, the resident run clinic. For those first few months, you're staffing everything with your chief residents. And then for the first few months when you're on call, you're on that buddy system or you're staffing everything with your upper level resident. So you really have a mentorship and relationship there. I've also found doing research projects, there's a huge mentorship in between the residents with doing research projects, and maybe you guys can chime in, but usually if you have a senior resident doing a research project, they've pulled in a junior resident who's helping them as well. And so that's something fun that I've noticed. I think curriculum development is a huge aspect. You have so much freedom at Mayo to do projects that you want to do. So for example, I started Olympics when I was a resident. Because I wanted to do it. And I asked Dr. Barkmeyer, can I start this project? And he said, sure. And I did it completely on my own as a resident. And we just finished our 6th year of doing it. And so that was a curriculum that I developed as a resident, and we still do it. And so there's plenty of opportunities for you to mentor, for you to change the program. I think the residents are a huge voice and heart of our program. And we want to collaborate and communicate, and all the big good changes have been kind of resident run. So that's one. And then I'm gonna start reading some of these other questions that I just screenshotted, and then maybe I'll call out some people to answer them. I really like this one. Do the resident run clinics focus solely on emergency department transfers and walk-ins, or is there also a component of continuity clinics, like developing and following your own cohort of patients over your residency? Bryce, do you want to start with that?
Yeah, absolutely. So it's a little bit of combo of both. So most of the COS clinic is basically emergent or urgent kind of walk-in type of problems, as well as any patient that you see on call. That being said, then they become the second part of your question. So any patient that you see, you get them through whatever their acute problem is, but then you are the one following them for continuity for the rest of your residency career. Like Ali was saying, gosh, I probably had my own patient panel of probably 500 patients when I was finishing last year. And I mean, I still see those patients because I'm still here. But they are ones that you follow yourself the whole time. And so in addition to that, so all these patients that you see, and then as they come in for additional checkups, whether that's glaucoma follow-up, whether that's their cataracts get worse and they need surgery, again, you're the one who is responsible kind of for guiding them through all their cares. And if they need a surgery that or a procedure that you are capable of doing, you're the one doing that. Also, then I would add, when you are in your PGY4 year, you basically are running your own clinics just all year long. And that includes a component of one, cataract surgery consults. Again, this is kind of a unique thing where you're seeing your patients for a cataract surgery consult. They only know you as their doctor, as their surgeon, through and through. You sign them up for surgery, you do their surgery, you see them afterwards. But also, you see a variety of just general patient consults for general eye exams, for whatever that may be. So that can be literally anything. So there's a combination of both of those, both the acute stuff, but then also following longitudinally. And any patient you see is yours for your entire residency with all the support you need for them.
Thanks, Bryce. Love it. We had one question about the call schedule. And we can go in more in depth with this, but basically all our primary call is taken by PGY2s, and then backup call is PGY3s, who are there right with the PGY2s on buddy call, and then direct backup. And then PGY4s are there for surgical issues like globes or other surgical emergencies. And then the next level is the fellow and then the consultant. I don't know if there's more anybody wants to say about call, but I would kind of leave it at that. Looking through some more chat questions.
Dr. Tooley,
Yeah.
would you mind if I just answered the question? There was an excellent question about the interaction between the residents and the fellows. And I think it's a really important point that I would really encourage everyone to ask on all of your residency interviews, because it's a really strong factor on how your surgical training is going to be. And you want to think about it and sort of how can a fellow hinder or help your experience learning as a resident. And if you have a place where there's just tons and tons of fellows, then obviously the fellows are trying to get their surgical numbers, and that may mean that less are falling to the residents. But on the other hand, if you don't have any fellows, then there may be a little bit of, maybe less comfort asking for help on call. Not that it's ever really an issue for us to contact any faculty member, but the fellow can understand you on a different wavelength than a faculty member can sometimes. So it's very helpful to have a fellow that you can rely on, and that's going to be helpful on call, in clinic, and just asking general advice questions about residency and all these types of things. So there's the pluses and minuses. And I really think that here at Mayo, we have an excellent balance between these two. We don't have so many fellows that they're hindering our surgical experience at all. The fellows that are here are really, really beneficial to us on call. I cannot overstate how much we work with the fellows on call, especially the plastics fellows, the retina fellows. They are just instrumental in our learning, especially for call and in clinic. But then, for example, the cornea service doesn't have a fellow. And so you're getting tons and tons of excellent cornea experience, anterior segment surgical experience that really sets you up very well for the later cataract surgery rotations. So for example, while I was on cornea as a PGY2, I was able to assist on multiple K-pros, iris prostheses, and play a significant role in several DSECs, DMECs, rebubbling procedures. I did a primary pterygium, all sorts of things that we do, amniotic membrane. So there's an excellent surgical experience for that reason as well. So that's a really important point. Thank you for bringing that up. I just wanted to put that out there, and hopefully it's a helpful point for everyone going forward.
Thank you, Ali. That was great. Dr. Barkmeyer, could you briefly touch on feedback and how we give feedback to residents? Because there's a great question about feedback. And I think that that's an excellent question to ask as someone applying to residency. And it also kind of shows the culture of the program and something that we've talked about a lot. You want to touch on that real quick?
Yeah, absolutely. So the way our program's set up, when you're seeing patients in the COS clinic. There are different faculty that rotate through there at different times to provide supervision, and there's a lot of one-on-one sort of organic, natural feedback. And likewise on the rotations, you go through your rotations, your subspecialty rotations, and you work very, very closely with all the different faculty for a month or two at a time, depending on the situation. And we have a mid-rotation review where basically you perform a self-assessment for how you think things are going, what procedures you've done, what you want to do more of, what you have questions about, what you feel like you need to work on. And then the faculty on the service discuss amongst themselves, and you have a one-on-one meeting with the faculty to talk about that. So then you can change the clinics or ORs a little bit if you need to get a little bit more of some experience, or you just get some formative feedback. And then at the end of the rotation, there's a rotation test. There's sort of a standard online web-based feedback forms. And then all of this goes together into the clinical competency committee discussions, where a group of 6 faculty discuss how everyone's doing. And then program director, we meet a couple times a year for more formal meetings to assess how everything's going. So it's really a wide range of feedback, a combination of real-time, in-person, organic, formal, and mid-rotation reviews.
Love it. We're running out of time, but in the last few minutes, I want to talk a little bit more about mentorship, because I think it's super important, especially for you to understand the kind of the flavor of and the culture of the department. I think Dr. Bakri would be great to talk about mentorship. If I could turn it over to her a little bit to talk about kind of our views on that.
So I think with mentorship, I mean, we've covered a lot, and certainly John Chen. John Chen's a great mentor, but he's also covered mentorship a lot. So there's formal and there's informal mentorship. And even though you'll be allocated somebody when you arrive, it's always good to have somebody to speak to. I think people naturally gravitate, to others who share either their, similarities in life, or similarities in goals, or a similar kind of subspecialty in ophthalmology. And I would highly recommend that one has several mentors for different things. And sometimes, mentors will need to change with time as one evolves. Certainly, there's a very diverse faculty, and the faculty has very different experiences in life, as well as different paths to academics, whether it's basic science path, whether it's a clinical trials path, an educator path, a global health path, so on and so forth. And so there is really absolutely no issue with getting mentors. And I think any of the faculty would be super delighted if you approach them and asked for their mentorship, either on an ongoing basis, or for specific help with specific things at the times that you need them.
Love it. Dr. Chen, anything else re-mentorship you want to chime in?
No, I think, of course, Sophie or Dr. Bakri really had a wonderful job kind of summarizing it. Again, the mentorship we provide as faculty is something we really strive. But as they mentioned, as residents, you're going to be mentoring medical students. You're going to be mentoring your co-residents. It's not a one-way street. It's really an amazing place to be able to have wonderful colleagues to work with, and really grow together. I think ophthalmology is probably got the highest learning curve of any subspecialty, because in medical student, you have a lot of exposure to cardiology and pulmonology and all those things. And you probably have 2 weeks of ophthalmology. And therefore, you've got to learn it all during your PG 1 and 2 year. And it's a fast learning curve. You've got wonderful mentors here. They're going to want to teach you. And as you become senior residents, you're going to be mentoring your younger colleagues. And it's, I think, a wonderful environment to do that.
Thank you, Dr. Chen. I'll turn it over to Dr. Bruckmeyer.
I was mid-typing about one other upcoming change in the program, just the new wet lab we have. That's fantastic. We're in the process of sort of upgrading a whole longitudinal curriculum. because now that we have integrated PGY1 residents in our program, we're putting together a curriculum for the PGY1s and 2s, and to really give you the confidence and skill set you need going into your surgical rotations, not only to feel better as you go into them, but you also get to do more as you show mastery of some of the basic skills that you don't have to practice for the first time or at early stages on patients. So this is really a win-win, and we're excited to really expand how we do some of our surgical practice curriculum. So I want to respect everyone's time. Really appreciate everyone coming out and joining it. This is a really exciting time of the year. Congratulations on choosing ophthalmology to all of you. It's such a fantastic specialty, and I really look forward to seeing so many of you over the next couple months. But thank you for joining us. Any final words from anyone on our faculty?
I
Good
just
luck.
put in the chat one thing, and feel free to email me if you have any extra questions that we didn't have time for tonight. aul.bryce@mayo.edu. Some of my colleagues are putting theirs up in the chat as well. It's just my last name and first name you can see here. Happy to answer any additional questions if we weren't able to get to yours tonight.
Thank you so much, everyone.
Have a good evening.
Thank you so much.